Oh, hello and welcome to the Patient First podcast. I'm your host, Dr. Bryan Laskin, and I am excited that you're here because it's story time for the first time ever on the Patient First podcast. Why? Why are we doing story time? Of course, it's because our episode is brought to you by my new book, Dental Disorder, which is all about the biggest problem in dentistry and how to solve it. Now, this story is, of course, from this book. And if you read the Patient First Manifesto, my first book, you'll know that I like to make points, illustrate them, and hopefully be entertaining because nobody wants to read a boring book. And I certainly don't want to write a boring book. And so I try to use stories to convey points. And today we're going to be talking about one story. I'll be reading a story from my new book, again, available at dentaldisorder.com. If you're watching this streaming on YouTube or other platforms, you'll notice I have a crackling fire behind me. I have my cup of Joe. Hopefully you have your cup of Joe or your glass of wine or your beverage of choice. And it's story time here. And I hope you enjoy it. Let me know what you think. Like, subscribe, comment below if you agree with the points of story time today. And our story today, my friends, is called The Molar Muffin Mishap, named by yours truly, of course, and written by yours truly. Now, this is from chapter 2 of Dental Disorder, the chapter called The Typical Disorder. And of course, if you're not aware, every chapter, which you probably aren't, every chapter in this book is about a different disorder. So today, my friends, The Molar Muffin Mishap from The Typical Disorder. You can find the book at dentaldisorder.com. Searing pain shot from Lisa's jaw up through the center of her brain. Ow! She exclaimed as the throbbing commenced and she dropped her blueberry muffin on the floor. What's wrong? Asked her husband. Something in that muffin crunched, Troy, and now my face feels like it's on fire. Can you call the doctor? Call? All right, Boomer, hold on, Troy joked while he pulled out his phone and opened his app with a couple of clicks. Let me take a pic for Dr. Olson over at Lone Tree Hospital. Remember, he sure helped with Billy's sinus infection a few years ago. Lisa opened her mouth and Troy couldn't really see anything, so he flipped on the light on his phone and snapped pictures of Lisa's upper and lower teeth, as well as her frowning face, mainly for his own amusement. He then added a quick note to the pic stating, Lisa lost the fight with a blueberry muffin, Doc. Now her face hurts. Can you see anything? Or should I come in? By the way, little sidebar. My dad used to always say, does your face hurt? Well, it's killing me. Appropriate to this. Anywho, a slight audio tone went ping, and the familiar green check mark let Troy know that Lisa's information was in the right hands. Troy said in his most assuring voice, Lisa, let's get you some ibuprofen while we wait for Dr. Olson to let us know what to do. The couple went upstairs to get some ibuprofen, but before they could even find the bottle, Troy's phone buzzed with a message from Dr. Olson's office. Dr. Olson took a look at the images, and it seems like this may be a dental issue. We've already sent your message to your dentist, Dr. Caring. You just need to authorize the transfer, and I'm sure she will get Lisa taken care of right away. As if on cue, Lisa's phone started playing the theme to Friends, indicating she had a message. This prompted Troy to complain, great, now I'll be singing that all day. Horrible song, my friends, right? Anywho, Lisa looked at the message and said, man, I hope Dr. Caring can help. We should have known that this was a dental issue. By the way, sidebar again, 1/3 of dental emergencies end up in the emergency room. So Lisa's story, not unusual. Lisa then opened the app and authorized her record transfer with 3 simple clicks. After finally finding and taking some ibuprofen, it was in Troy's suitcase from the trip to Bermuda last week, Lisa's phone buzzed again with a message asking Lisa to use the phone's biometric scan to access its contents. It read, Lisa, it's Dr. Caring. It looks like that tooth on the lower right that we've been watching over the last couple years has broken. May have happened in your practice, right, friends? Or maybe to you. From the picture you sent and looking at your x ray here, I think you should see the root canal specialist, Dr. Now. I've already sent a request, so just click on the link below and you can schedule your appointment. Looks like she can see you at 10 or 1 today. Troy, let's get moving. I got an appointment in 20 minutes, was the last thing Lisa heard herself saying, with a bit more urgency than was probably required to get her husband moving before hopping in the car and getting the care she needed. It was only, and now we digress, my friends. I apologize. This was not a science fiction book. The dental disorder, is not science fiction, nor is it a happy dream that I had. The story, obviously, my friends, did not happen. Lisa's story is not even possible today, but it should be. So please, still reading from the book right now, allow me to retell this way too common scenario utilizing a more relevant format that depicts how this would actually go down in the real world today, given the current workflows we are stuck using. So we have a second story today. Not only is this the first story on the Patient First podcast, my friends, but we have the follow up story, which is called Today's Tragic Molar Mishap. So, my friends, the same story, but how it's possible today without the workflow that was described in the first version. Searing pain, again, shot from Lisa's jaw up through the center of her brain. Ow, she exclaimed as the throbbing commenced and she dropped her blueberry muffin on the floor. What's wrong? Asked her husband. Something in that muffin crunched, Troy, and now my face feels like it's on fire. Can you call the doctor? After a long pause, Troy sheepishly asked, Who do we see again? Attempting to mask the fact that he was at least 5 years overdue for a physical. Dr. Olson. Here's the number in my phone, you troglodyte. Lisa growled in pain and frustration. And by another sidebar, come on, troglodyte, if you can work that into your book, you have to. Anywho, after searching for doctor, physician, and hospital in Lisa's contacts, Troy finally found Dr. Olson's number after typing in DR period. Welcome to Unfair Hospital. Due to a recent increase in infections, we are experiencing an unusual large volume of calls. Your expected wait time is 12 minutes, the robotic voice in the recording chirped. After a 48-minute hold, hey, been there. But being transferred twice and hung up on once, Troy was told that Dr. Olson would be able to see Lisa in 2 days. And that it was not, if that was not acceptable, they could go to urgent care. Given the level of intense pain, Troy took Lisa to the emergency department at the local hospital. What Troy did not realize is that he was making the same mistake as the 2 million plus other people with dental emergencies, again, 1 in 3, that end up in the ER each year to the tune of roughly $750 per visit, totaling a staggering $1.6 billion annually. In fact, my friends, I've talked to physicians, it's probably double that. It's about $1,400 per visit, but that was the data I had at the time of the writing of this book. As the ER was filled with acute cases, it took over 4 hours to see the physician who instantly recognized that Lisa had a dental issue. Obviously, dental care is completely outside of their scope of practice, and this particular physician had no dental contacts. He simply told Lisa to go call her dentist. Unfortunately, Lisa's debilitating dental anxiety had prevented her from seeing a dentist for the past 5 years, so she didn't even have a dental office's contact information in her phone. It was also a Saturday, so Lisa ended up leaving a message at 4 different dental practices before finding a dentist that picked up her weekend call. Would that be you, my friends? I carry on. After setting up the visit, Lisa parked her car in an expensive ramp and made her way to the practice of the dentist, Dr. Weekend. Dr. Weekend proceeded to take a bite wing and PA radiograph and performed the appropriate endodontic testing. It took 15 minutes to determine that Lisa's molar was necrotic, and the dentist did not feel comfortable doing the endo. So Dr. Weekend decided to circle number 31 on a 4x6 piece of paper, the professional referral slip, and scrawled the word necrotic alongside Lisa's name and the phone number. He then printed off a copy of Lisa's x-rays, complete with the white streak lines that announced to the world that his printer was running low on ink. After his call to the endodontist went to voicemail, Dr. Weekend wrote a prescription for antibiotics and a few pills to help Lisa manage the pain for the next few days. Have you ever been there, my friends? Probably weekly. Let's carry on. Dr. Weekend handed Lisa the scribbled referral and prescriptions, cheerfully chirped, "Good luck with that tooth at Dr. Root's office," and then escorted Lisa out of his practice, reassured in the knowledge that she was now in safe hands with Dr. Weekend's friendly neighborhood endodontist, who also happens to have great seats in the Minnesota Wild that she shares with Dr. Weekend a couple times a year. Good, that's great. You refer all your practice over there, and they give you tickets to a ball game, or in this case, a hockey game. Yes, Dr. Weekend's job was done, and the job well done it was, wasn't it? Let's check back in on Lisa to find out. At this point, even though Lisa has seen several doctors and spent over half a day seeking treatment, she was still in the same situation, still in pain. I do take liberties with reading because I want to entertain myself, my friends. So thank you for bearing with me. Desperate for relief, Lisa went directly to her favorite pharmacy, filled the prescriptions, and left a voicemail for Dr. Root, pleading to be seen as soon as possible. The good news is that Lisa took her meds immediately and started to feel better. However, when Dr. Root's office called 2 days later to get her scheduled, she decided she didn't want to waste more time and money seeing doctors who didn't solve her problem. Her miserable experience last week more than confirmed that she was right to be so anxious and wary of dentists. She felt better thanks entirely to the meds. No thanks to the doctors. So Lisa confidently crumpled up and threw away her referral slip in the trash. Obviously, she didn't bother to schedule that appointment with the endodontist. The only other person who knew that Lisa missed her treatment appointment was Lisa's nosy coworker, Bob, who saw the referral slip and radiographs, which contained her EPHI, obviously, on top of the garbage in the office kitchen. Lisa then went down about her day without realizing that the next time her infection flared, it could close off her airway, in which case an ER visit would be more appropriate, provided she made it there in time. Of course, neither Dr. Olson, Dr. Weekend, nor Dr. Root followed up to prevent such a life threatening complication from happening, as the software applications they pay several $100s a month for lack the insight required to follow up with Lisa appropriately. This grim scene, my friends, obviously doesn't happen with every dental emergency today. It is estimated, however, that one dental emergency ends up in the emergency department of a hospital every 15 seconds in the United States. So this scenario is, in fact, quite common. Let's be optimistic and assume that Lisa was more compliant, adherent patient and ended up seeing Dr. Root for her root canal. You might think our problems would end there. You would be wrong. And my friends, I go on to explain what happens when Lisa goes to see the endodontist. But you can find that story, the conclusion of all the problems that happen with the molar mishap and the opportunities to solve them, along with 12 chapters of disorders and one chapter which is called The Cure in Dental Disorder, which is available now. Let me know. Would you like more story time here on the Patient First podcast? That obviously has a point. And if you like the story, if you like the podcast, like, comment, and subscribe. If you like the stories, go pick up a copy of Dental Disorder. And of course, I look forward to seeing you right here again next week on the Patient First podcast.